Hi, thank you for joining me today. This is Michigan Health Star. I'm your host, Aurore Henze. We are doing part 2 of the interview with Bingham from Premier Private Physicians. The people have insurance already, so they're going and they're going to pay extra to get the, you call it the direct primary care model. Can you give a ballpark range of how does it run, like basically per family or per person?
We do at Premier Private Physicians. It's $2,500 a year. That breaks down to $209 a month.
Wow, that's really affordable. What do you think in terms of when we're looking at, and we talked about this with the opiate addiction shows, stepping out like with the insurance problems, because the insurance isn't covering, especially we talked about with the opiates where they're having resistance with the insurance because these insurance companies are only covering opiates and they're not covering any type of alternative care, even though as a naturopath doctor I've been working with this for years. Things like enzymes or alternative things for pain are, I mean, I've always paid out of pocket anyways myself, but I've never seen them to be so expensive that I couldn't afford it. I mean, when you're talking between drugs and more natural modalities, there tends to be a big difference. But a lot of people don't know that. They want to rely on the insurance. But there's been a big resistance in the insurance to cover other therapies that people need. How do you relate this basically to the direct healthcare model?
Well, first of all, we're conditioned to use our insurance for all healthcare, and we're in the camp that believes that primary care, when you look at the definition of insurance, is really not an insurable event. We use our car insurance completely different than we use our health insurance.
That's true.
If you drive your car to the to the oil change place, you're not going to pull out your AAA card and use that for a $20 oil change or $10 windshield wipers, or even $600, $800 tires. Even those are expensive purchases. We still don't use the insurance for that because those are frequent, low-cost things that we need to purchase out of pocket. Otherwise, if we use the insurance, then we know it's going to affect the price of our premiums.
So, how do you feel like on that holistic healthcare front, that fitting into the direct model that you talk about? You see that in the future, something being implemented more, or still kind of kept separate?
I think that the more time that a primary care physician has with their patient, the more they would be open to alternative type of models. Right now, the physician, if the patient comes in and says, I've read about this, and I think that it would be good for me, the physician in the fee-for-service model right now isn't getting reimbursed for that type of referral.
Right.
Because it's not part of the insurance world, as you know.
This is something that's frustrated me for many years when I worked in oncology and I worked at pediatrics. It's just, that's one reason why I got out of it. I just kept thinking these people need more time and there's so much more you could do, and it's a system, it becomes a machine where these people are getting in and out and people are slipping through the cracks.
Okay.
They're not getting really the kindness and care that they need, even on an emotional level.
Right.
Especially when people are facing things like cancer and very scary diseases. I felt like just time in general was very precious. So I appreciate the fact that, I mean, this is exciting, and this is a very exciting time. I know a lot of people are scared right now in the United States with the healthcare model. There's a lot of changes, but I have to say, since I've known you, when I first met you, I hadn't even heard of it, and now it seems like this is where it's going. So I'm really happy for you.
Thank you.
Thank you. So thank you so much for coming today.
Thank you.
I hope you guys all learned something about this amazing new healthcare model, and how can people get in touch with it if they want to find out more.
You can go to premiermd.com, or you can find me on LinkedIn, Kyle Bingham, or just talk to her.
All right, you heard it. Thank you so much. Thank you for coming.
Thank you.
Nice to see you. All right, we'll see you next week.